Welcome to the Deep Dive. Today, we're tackling a really vital area within healthcare, total quality management, or TQM. You've given us a fascinating collection of material. I mean, everything from the official word from global accreditation giants like Joint Commission International and India's NABH,
Right.
to practical insights from consultancies like Supremediq, the sort of broad view from iSQA, an engaging peek into the QI Playbook podcast, and some, detailed articles and book excerpts that really get into the nuts and bolts.
Yeah, good mix.
So our goal today is really to cut through all of this and understand what TQM actually means for healthcare. In practice, its core ideas, the impact it can have, and the crucial role accreditation plays.
Exactly. So if we boil it down, TQM in healthcare, it's really about embedding this mindset, this culture of continuous improvement right through the whole organization.
Okay.
And always, with the patient's well-being and their experience right at the center.
The focus, yeah.
It's a philosophy that, it touches everyone. Doctors, nurses on the front lines, the admin teams behind the scenes, everyone. And it relies heavily on using data, not just to look back, but to proactively shape better outcomes.
Okay, so let's dive deeper into those foundational ideas then. The core principles that make TQM tick in healthcare. Looking at the sources, a few key themes really jump out. First and foremost is this patient-centered focus. It sounds like more than just treating symptoms, right? It's recognizing patients are the most critical people involved.
Absolutely. One source really highlighted that organizations using TQM, they make patient needs and satisfaction the real drivers behind every decision.
So the whole experience, building trust,
Yeah.
making sure their needs are met.
That's right. And it's not just, sending out a survey after they leave.
Right.
It's about actively listening. Throughout their care journey, understanding concerns in real time and using that feedback constantly to refine and improve how care happens. It's about building a system that's genuinely designed around the people it serves.
And another cornerstone seems to be this idea of continuous improvement. It's not like reach a good standard and then stop.
No, definitely not.
The sources really emphasize that healthcare processes need to be constantly evolving, whether it's finding ways to shorten waiting times, which I know is a huge frustration for people.
Oh, absolutely.
Or improving diagnosis accuracy, or just streamlining admin tasks. TQM seems to be about always looking for better ways.
And it's not just hoping things get better, right? Continuous improvement in TQM, it's structured.
How so?
Well, it involves identifying specific areas that need work, making changes, and then rigorously checking, did those changes actually lead to improvement? It's this cycle, learning and adapting.
Which leads perfectly into the next principle, data-driven decisions.
The
sources are really clear here. Gut feeling isn't enough in healthcare.
Not at all. TQM stresses using measurable data, actual patient outcomes, to guide both clinical and operational decisions. This data can help pinpoint those bottlenecks we just mentioned, show where inefficiencies are, and even help organizations kind of anticipate future needs, future trends in patient care.
Yeah, what's interesting there is how data turns maybe isolated incidents into broader patterns you can actually fix systematically.
Exactly. By consistently tracking the right metrics, you get a much clearer picture of strengths and, maybe more importantly, where you need to develop. This lets you make targeted changes and, objectively measure if they worked.
Then there's teamwork and leadership commitment. It sounds like TQM really pushes against those traditional silos in hospitals.
It does. It's not just doctors and nurses responsible for quality. Everyone, support staff, facilities, team, everyone plays a role.
Right.
And the sources strongly suggest that visible, active commitment from leaders is absolutely essential. They set the vision, build the environment for this continuous improvement culture to actually grow.
Yeah, I can see that. Without that top-level buy-in, these things probably fizzle out.
They often do. Leaders need to walk the talk, basically. Communicate why quality matters, but also actively support and participate in the efforts. They set the example, and they empower their teams.
Okay, and finally, a principle that really resonated was prevention over correction. Being proactive, heading off problems instead of just reacting.
Which is obviously huge in healthcare.
Right. TQM aims to anticipate risks, errors, infections, complications, and build robust systems. Processes that prioritize safety from the start, minimizing risks before they happen.
Like designing a really solid checklist for a critical procedure, maybe?
Exactly, that kind of thing.
Yeah.
Making sure every step is followed correctly every single time.
It's about building safety into the system's fabric, not just dealing with consequences later.
Yeah.
And focusing on prevention, it can significantly reduce harm to patients and also, frankly, avoid the often huge costs of fixing errors after they happen.
So, okay, we have these key principles. What are the actual tangible benefits an organization sees when they really embrace TQM? The sources seem pretty compelling.
Absolutely. The most critical benefit, no question, is improved patient outcomes.
Makes sense.
By focusing on quality everywhere, TQM can lead to fewer medical errors, lower infection rates, better management of chronic conditions. It just means patients get better care, have better health results.
And tied right into that is higher patient satisfaction.
Seems logical, right?
It does. When patients get timely, respectful, effective care, their satisfaction goes up. And the sources point out, this isn't just good for the patient, it really strengthens the organization's reputation in the community.
That's a big deal today, isn't it? With everything online, reviews.
It's crucial. A reputation for high-quality, patient-centered care can be a major differentiator. Helps attract and keep patients.
Interestingly, TQM also seems to lead to more efficiency and cost savings. Seems counterintuitive, maybe, investing in quality.
You'd think, but the sources suggest that by streamlining workflows, using resources better, cutting out unnecessary steps or procedures, you actually reduce waste and manage costs more effectively long-term. Okay, that's a key insight. Inefficiency in healthcare must be incredibly expensive.
Hugely. Not just money, but staff time, potential delays for patients. TQM helps find and fix those inefficiencies. Leads to a more sustainable, cost-effective operation.
Another benefit mentioned is a stronger organizational culture.
Yes. When TQM is really embedded, it fosters this culture of continuous learning. It empowers staff, all levels, to actually contribute to quality improvement.
Right.
And that can lead to better collaboration between teams, spark innovation, and honestly just boost staff morale.
A positive, engaged workforce must be essential for delivering good care consistently.
Absolutely. When staff feel valued, have the tools and training, feel empowered to make a difference, it creates a much more dynamic, effective environment.
And finally, there's a clear link made between TQM and compliance, accreditation. Frameworks like TQM seem to align really well with standards from bodies like JCI and NABH. So embracing TQM helps organizations meet or even exceed those external requirements.
That's a vital link. Accreditation is like an external stamp of approval on your commitment to quality and safety.
Right.
And TQM principles offer a practical roadmap for actually achieving and keeping that recognized level of quality.
Speaking of accreditation, let's dig into these key players, JCI and NABH. JCI, the sources say, is globally recognized, a leader in healthcare quality, patient safety.
Yeah, their mission is basically to enable and recognize the highest standards of care everywhere, for everyone.
Okay. And they offer different programs, not just accrediting whole hospitals.
Right, hospital accreditation, but also certifications for specific clinical programs, even things like healthcare sustainability now and telehealth.
And their scope is truly international, you said.
Oh, yeah. Accredited organizations in over 70 countries, their standards are widely seen as a global benchmark.
And the process itself sounds tough.
It's described as rigorous, an evaluation based on internationally recognized standards. Helps organizations measure, assess, and keep improving across a whole range of areas.
And the benefits for an organization that gets JCI accredited sounds like quite a few.
Yeah, the sources highlight things like better teamwork and communication among staff, which ties back to TQM itself, valuable learning opportunities during the process, a clear competitive edge, stronger community confidence, better risk management, and ultimately, that deeply ingrained culture of patient safety.
That culture piece seems key.
Definitely. JCI's big vision, one source said, is a future of zero preventable harm and highly reliable care. It's powerful.
So it's not just passing a test, it's a fundamental commitment.
Exactly. A commitment to constantly striving for the safest possible care.
Okay, turning to NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Yeah.
This is specifically for India.
Yes, it's part of the Quality Council of India, set up to create and manage accreditation programs for healthcare organizations within India.
And their goal?
Primarily to address Indian consumer needs for healthcare quality, set benchmarks for the Indian health industry. They operate with functional autonomy but have stakeholder support.
So JCI is global, NABH is focused on India, but both are driving quality through accreditation.
That's the core idea. Different scales, but that shared fundamental goal of improving quality and safety via a structured framework.
And the connection back to TQM seems undeniable.
Very much so. Both JCI and NABH set standards that really reflect those TQM principles we talked about. Continuous improvement, patient safety focus, using data. So getting accredited by either body, it can be seen as a major milestone in an organization's TQM journey. Like external proof it's working.
External validation, yeah. That the principles you're using internally meet recognized standards out in the wider healthcare world.
Precise.
Now, interestingly, one of the research articles you shared looked at accreditation's impact in U.S. hospitals. What did that find?
Well, it found that hospitals accredited by independent organizations did show slightly lower readmission rates for some common conditions, which is good.
Okay, a positive sign.
But they didn't find a statistically significant difference in overall mortality rates. And the study also noted there wasn't a clear additional benefit specifically from Joint Commission accreditation compared to other independent bodies.
But there are caveats, right? It was observational.
A really important caveat, yes. It's observational, so you can't draw definitive cause and effect conclusions. It has limitations.
So it doesn't give the whole picture.
Exactly. Accreditation is complex. Its influence on different outcomes can be affected by many factors, but it does raise questions, How do we measure the impact of different accreditation models? What outcomes are they really influencing most directly?
Maybe it's more about process and experience, which then influences mortality longer term.
That's possible. It's something researchers continue to explore.
Okay, so TQM and accreditation have potential benefits, but what about the hurdles? The sources also talk about challenges in actually implementing TQM. What are some common ones?
Well, one that comes up a lot is cultural resistance. Resistance to change.
The human factor.
Exactly. Healthcare pros, like anyone, can be hesitant about new ways of working. Shifting from traditional, maybe hierarchical ways to this collaborative, continuous improvement mindset. That's a big cultural shift. Takes time and effort.
And that leads right to the need for training and education, I imagine. Consistent training.
Absolutely critical. You can't just announce, we're doing TQM now. Staff need the knowledge, the tools, the problem-solving skills to actually participate in quality improvement, to really get the philosophy.
Across all levels, too, not just clinical staff.
Right. It requires a different way of thinking about processes, outcomes. That means a significant investment in ongoing training reaching everyone. Clinical, admin, support.
Another practical challenge must be the initial investment, time and money.
Definitely. Implementing TQM effectively can mean investing in new tech for data tracking, analysis, redesigning existing processes for efficiency and safety, and like we just said, dedicating real time and resources to training.
So leaders need to be ready for that upfront cost, knowing the long-term benefits should outweigh it.
Yeah, it's recognizing that real quality improvement isn't free. It needs strategic resource allocation money and people to get sustainable results.
Now, looking at what actually makes TQM work long-term, one of the research articles did a systematic review, looked for key predictors of success across different studies. What popped up consistently?
Yes, and what's striking is the consistency. Education and training came out as the most frequently identified predictor.
Really underscores how vital it is to equip staff.
Absolutely. Give them the skills and knowledge to drive quality improvement.
What else?
Close behind was the emphasis on continuous quality improvement itself. Sounds a bit circular, maybe. But it highlights that a sustained organizational commitment, just constantly seeking and making improvements, is fundamental. It's not a project, it's how you operate.
Embedding it in the DNA, like you said earlier.
Exactly. Making it routine, not just isolated initiatives.
Not surprisingly, a strong patient focus and commitment to patient satisfaction also showed up as key predictors.
Well, yeah, if the goal isn't ultimately improving things for patients, what's the point?
Right, the North Star.
If your quality efforts aren't benefiting the patient, you're missing the central idea.
And there's that crucial role of top management commitment again. Visible, active support.
Yeah, without that unwavering engagement from the top, TQM efforts are much more likely to just stall, lose momentum.
Leaders need to be champions for it.
Vocal champions, yes. Actively participating, showing commitment through actions, through resource allocation.
And finally, teamwork was a big one.
Consistently emerged, yes. TQM thrives where there's strong collaboration, open communication, effective teamwork across different departments, different professions.
Healthcare is all about teams anyway.
Inherently team-based.
Mhm.
TQM gets that. It stresses breaking down silos, communicating effectively, working together on shared quality goals.
Did the research mention other factors too?
Yeah, a range of others. Leadership more broadly, active employee involvement at all levels, managing key processes well, that sustains support from upper admin, reinforcing the top management point. Thorough planning, using data and information analysis effectively, good supplier relationships, and just overarching creating that deep-rooted, quality-oriented culture. It really shows TQM is comprehensive, touches everything.
Okay, to make this real, the QI Playbook podcast excerpt had a great example. Shakti Medcare Institute.
Fantastic example, yeah. They implemented unit-based quality circles, small teams in each department meeting regularly to discuss and implement improvements.
Right result.
Really impressive. Over 120 process improvements in just 1 year.
Wow.
It just highlights the power of empowering staff on the ground, giving them ownership of quality in their own areas.
I know where the problems are.
Often they have the clearest view, they see what works, and definitely where there are opportunities to do better.
The podcast guest also shared some practical advice for hospitals starting out. What were those?
Yeah, really actionable stuff. Start by clearly defining the organization's core quality values, communicate them often, transparently, and crucially, model the desired behaviors from the top.
Lead by example?
Exactly. Commitment to quality really sticks when leaders actively engage and show it matters to them personally, sends a powerful message.
And the podcast wrapped up with 3 concrete takeaways.
Yes. First, start daily huddles in departments. Quick check-ins, problem-solving, communication.
Okay.
Second, launch those cross-functional quality circles, encourage collaboration, break down silos.
Makes sense.
And third, fundamentally measure what truly matters to patients, their outcomes, their experiences, not just internal KPIs.
Oh, that brings us right back to being patient-centered.
Full circle, yeah. Those are all practical steps any organization can take to start integrating TQM principles day to day. And that focus on patient-centric measures is vital, ensures efforts actually benefit the people they're meant to serve.
So wrapping up our deep dive today, it's clear TQM in healthcare is this comprehensive, ongoing philosophy.
Enduring, yeah.
It's all about that relentless pursuit of improvement, always keeping the patient, their needs, their experience, right at the heart of everything. Accreditation bodies like JCI and NABH, they play a really crucial role, setting standards, providing a framework that lines up with TQM principles, guiding organizations towards excellence.
They provide that structure, that external benchmark.
And while there are definitely challenges, cultural shifts, resource needs the research points to key success factors. Things like strong commitment to education, a real culture of continuous improvement, and visible leadership engagement.
Those keep coming up.
And real-world examples, like from the QI Playbook. They show the tangible, positive impact TQM can have, improving processes, empowering staff, making a real difference in patient care.
And it's crucial to remember, like we said, TQM isn't a destination you arrive at.
Right, it's ongoing.
It's an ongoing journey. Requires sustained commitment to those core principles to truly transform an organization and consistently deliver the highest quality care.
Okay, so considering all these principles and the potential benefits we've explored, here's a final thought for our listeners. Within a healthcare organization, maybe where you work or where you've been a patient, what specific areas do you think would benefit most from a really focused application of these TQM ideas?
Interesting question.
And how could the insights and standards from accreditation bodies like JCI or NABH help guide that process? Maybe it's thinking about patient feedback mechanisms or those persistent bottlenecks in workflows or areas where patient safety could be even stronger. It's about taking these big ideas and thinking, how do they apply specifically right here in the complex reality of healthcare delivery? Thanks for joining us for this deep dive.